Okay, well, good afternoon and welcome back to New Year 2026. Wow, it's hard to believe in here January's almost gone. So this time we'll call population health to order. And I'd like to have the clerk do the roll call, please. Okay, clerk, would you read our roll call vote?
Madam Chairman, you have 8 members present. You have a quorum.
Thank you. Thank you, clerk. And sorry to be a few minutes late. We'll blame it on Dr. Kumar down here. We were waiting on him. I think everybody is familiar with who everyone is, and I'm thankful to have all of y'all back on the committee. And I will check to see if anybody has any personal orders or announcements. Yes, Representative Clemens, you're recognized.
Thank you to the best subcommittee chair in the entire House of Representatives. I appreciate it. I actually have 2 items this morning. I just want to take a moment to recognize my interns who are joining me this morning, Mr. Owen Doyle and Shamaria Houston. If y'all would stand up, let everybody welcome you. They're going to be joining me here for the next couple of weeks. And also, Madam Chair, I just wanted to, given that this is the Population Health Subcommittee, I thought it was appropriate just to remind everyone how important what we say and what we do in this committee is, because I was looking at this weekend shocking statistics that 77% of U.S. counties have seen a decline in vaccination since 2019, according to Johns Hopkins. During the 2024-25 school year, coverage for measles, mumps, and rubella shots, diphtheria, tetanus, and pertussis, or whooping cough, polio, and varicella vaccines decreased among kindergartners yet again. MMR vaccination coverage was just 92.5%, as low as 92.1% in this country, well below the 95% threshold needed to prevent transmission of the measles virus. Coverage in Tennessee during this period was 94.4%, and exemptions rose to 3.8% in our state. There were 8,485 cases of whooping cough reported January 1st to April 24th in 2025. And these immunization gaps have led to measles outbreaks in multiple states and the highest number of measles cases since the disease was declared eliminated in the U.S. in 2000. As of today, there have been 2,540 cases of measles in the U.S., 2,144 confirmed cases in 2025 alone. This included 49 outbreaks in 2025 compared to only 16 in 2024. 69% of these cases were among children and teens. 93% were among people who were unvaccinated or whose vaccination status was unknown. 8 cases were reported here in Tennessee. In 2025, there were 3 confirmed measles-related deaths in the U.S. 2 were school-aged children, 1 was an adult. All were unvaccinated and had no underlying health issues. So to quote Dr. William Moss, Executive Director of the International Vaccine Access Center at Johns Hopkins, to reverse declining childhood immunization rates in the U.S., we need to focus on strengthening public trust in the safety and effectiveness of vaccines. And I would encourage my members, and I would remind my members, colleagues, that this starts here. It matters what we say and it matters what we do, because the public health, the population's health is at stake by the decisions we make in this room. Thank you, Madam Chair. I appreciate the time.
And thank you also. Does anyone else have anything else to say before I was going to introduce our staff and then we'll get going with our committee? Has anybody else got anything? Okay, so I did just want to recognize our new research analyst, Bart Keener. We're happy to have you this year. And legal service is Heather Asbel is returning to our committee for attorney. Joining our new attorney is Chris Yates and law clerk Haley Garcia. House Clerk is Paul, oh, is that the one we were saying? Okay. That's who you said was going to butcher her name. And then our Sergeant at Arms is again our wonderful Tommy Woodard. And from AV Services is Greg Yates. Thank you to all of y'all for being willing to be here and to serve us. So, okay. So let's get started then with the day. We've got 2 items on our agenda. The first one is House Bill 1400 by Representative Pearson. Okay, you have a motion and a second. And do you have any amendments?
Oh, can you hear me? Okay, there we go. Thank you, Chairwoman. I do have an amendment on this bill, and so I know that may be untimely filed, but that's 011863. And so if we have to roll this to next week, I totally understand. It's just a date change. to
Yeah,
2026.
well, we don't have the amendment here with us since it was an untimely amendment. So I think we will have to roll that then till next week.
That's perfectly fine.
Okay.
Thank you.
Without objection, we will roll that House Bill 1400 to next week. Okay, so yes.
Committee roll,
Well, it's,
or is it a member roll?
I guess it would be member row.
It's your call.
Yeah, I mean, it's an untimely amendment, so he asked that we would roll
Okay.
it because of not having the amendment for us to see.
Okay.
Yeah.
Just want to be clear for the rules.
Okay. Let's see. Okay, we'll move on to the second item, which is an HR 0007. Okay. Representative Pearson, you have a motion and a second, and I assume there are no amendments on this. So the bill is before us, and you can proceed with the description.
Thank you so much, Chair Lady and members. This legislation is simple but quite important, and I do have, it's bipartisan with the chairman of the Veterans Caucus, Monty Fritz, also supporting it. There's a House Resolution number 7 before you recognizing September 22nd as Veteran Suicide Prevention Day in Tennessee. The crisis that we're experiencing with suicide, but also particularly with our veterans, is one that's severe, it's stark, and unfortunately it's increasing and has increased in our state and across the country in a lot of ways. Now, we have seen decreases. It started to be the 22nd at the federal level because between 1993 and 2011, it was assumed that 22 veterans were committing suicide a day. There has been some decline to about 17 a day, but there's a problem that is persisting, and it's to help raise awareness that we care about veterans in the state, and that attention needs to be drawn to this very important issue and providing them services. Over the last few years that I've been here, we've talked a lot about mental health. We talked a lot about getting people the access that they need, but one of the first things that we all can do is provide more awareness. I represent Shelby County. We've got 52,000 veterans, people who've served this country. We have the most veterans of anyone else, any other county in the state of Tennessee. And so this is something that we're feeling very acutely. And in our state, every year, roughly 184 people, fathers, mothers, sisters, brothers, cousins, and friends, take their own lives who are veterans due to the stressors, post-traumatic stress disorder, and so many other causes that we have yet to really be able to deal with and to help them to solve. And so this is just simply a bill to recognize September 22nd as a Veteran Suicide Prevention Awareness Day in our state, but it's also a call to action for us to do more that we can to serve the people who served us. And so with that, I'll take any questions.
Okay, okay. All right, is everyone ready to vote? Okay, clerk, would you please open up the vote to vote? Clerk, would you please read the vote?
Madam Chair, you have 9 ayes, 0 nays.
Okay, so we are all in favor of moving forward HR 007. So all in to health full, yes. So your vote, your bill will be moving on, and congratulations, and we'll see you in full health. Welcome. Okay, as far as I don't have anything else on our agenda, so if no one else has anything, I will say motion to adjourn.
Thank you.
Okay.